try to make this a little bit interesting, and it is not about research. It's about this idea that is the end result idea. And I'll speak in the second half of the talk on how you track your patient outcomes and keep a surgical logbook and all that stuff on a free software called Notion. But before that, we'll go a little bit on the origins of the end result idea. I don't know how many of you know it. So a little bit of medical history first, if you are into that kind of a thing. This idea is actually, it was first envisioned by Dr. Ernest Codman, who was a Boston surgeon. Is incidentally an orthopedic surgeon. To most orthopedic surgeon, he is simply a name attached to this triangular harbinger of osteosarcoma, or to these famous shoulder pendulum exercises. Orthopedics, at least the spine surgeons know it, know Codman as Codman instruments, but Codman instruments has nothing to do with Codman. But in spite of that, the contributions by Codman span many specialities. In anesthesia with Dr. Harvey Cushing, who is the father of neurosurgery, he was the first person to publish or use ether charts, which eventually became the anesthesia records that you see your anesthetist writing down temperature, pulse, BP and all. Radiology, he was the first to use barium. He was actually the first person to use X-rays for the treatment of fractures. He was the first radiologist who was appointed at MGH, so branch of radiology did not exist before him. General surgery, there's a lot of work. He did a lot of work on bone sarcomas and all. If you know about shoulder surgeries a bit, he has this classic textbook on shoulder surgery. But it is the end result idea that is arguably one of Codman's greatest contributions, which a lot of people don't know about. But he was maniacally obsessed about this idea. He was married. He was married to one person, I think. But this was his main idea in his own words. Was this is a common sense notion that every hospital or every patient should follow every patient it treats or he treats or she treats long enough to determine whether or not the treatment has been successful, and then to inquire, if not, why not, with a view of preventing similar failures in the future. And I know some people in the audience do that, and I have learned from some of them. Dr. Bhojaraj has been keeping records for a very, very long time. But here is the picture of how he kept patient records on these cards, which have that hole at the bottom. And these are like library cards that go on in these drawers, and painfully they used to be typed. The last card below, I don't think you can read it, is the end result card in which the outcome was written. And he kind of insisted that every patient he operated, he would follow them up every yearly to see what is happening to them. Write cards, like the library cards, yeah. That's a generation different. I'm going to show you something simpler. But yeah, so every misadventure in a case or any case that lacked perfection, Codman was kind of very self-critical, and he used to classify them into these categories: lack of knowledge or skill, and lack of surgical judgment, etc., all these things. And it requires some degree of humility, which doesn't exist in a lot of spine surgeons. But you know, you do these cases, and at least the senior guys are wiser. But as a surgeon, it is very painful to kind of judge yourself and kind of categorize your patient as a lack of skill or judgment that has led to a complication. At least that's for me. But when Codman proposed this idea, it was obviously not well accepted by the audience. You know, I am speaking at a podium and telling you that, you know, you guys are making mistakes and all that sort of things. But it's actually the self-acknowledgement that mistakes and problems do happen in surgeries, but they have to be studied for them to be prevented. It's kind of the most important thing. And this conflict between Codman and all the other surgeons came to a head at this scientific meeting that he presented. When his turn came to present at this conference, he rolled out this cartoon which was created by his friend. And essentially for 5 minutes, he went on a diatribe, essentially insulting everybody in the audience. And this cartoon actually hangs outside the Countway Library in Harvard. If you ever visit Boston and happen to go that way, go to the Countway Library. They have a wonderful museum on medical history, and this cartoon hangs at the entrance of that library. Essentially, this cartoon, the one in the picture in the middle is that of an ostrich whose head is in the sand, and that ostrich is eating humbugs, if you know the meaning of the word humbugs, and that ostrich represents the patient. The patient doesn't know what is happening, but the ostrich is laying golden eggs, and it's kicking out golden eggs, and you see all those guys catching the golden eggs. Those are the surgeons, and they are benefiting out of whatever they are treating the patient, but they are not disclosing what is happening to the patient or presenting their outcomes. And that the panel there, these are the board of trustees of MGH. Codman was employed at MGH. So these trustees at MGH, I don't think you can read the lettering there. It says, if we let her know, her means the ostrich, the truth about our patients, do you suppose she would be willing to lay? So obviously this kind of direct conflict with the audience, it created quite a bit of stir in the newspapers and all. And he was made to resign from his chair, and for 10 years he was kind of ostracized. He resigned from his position at MGH, but then good ideas are hard to push them under the rug, and he remained unrepentant till the end. This end result idea for which he was so obsessed about eventually got accepted by the scientific community, and he actually chaired the standards committee of the American College of Surgeons, which eventually became the Joint Commission. And that Joint Commission, the best award for quality for hospitals and all is the Codman Award. So, if you ever visit Boston, that's this is a very wonderful place to visit, the Mount Auburn Cemetery, which is in fall. It has very beautiful colors, fall colors. The Codman is buried there. There is a gravestone there which has his quote. It says that it may take 100 years for my ideas to be accepted, and it literally took 100 years for something like that to come. And we all know the reasons why you should audit your own patients. I have a lot of students and fellows and young surgeons coming to me and asking me how you are keeping records. But even as residents and fellows, I would say that if you are in training, even if you are not operating the patients, you should keep your own records. And I did that from my training years, not as a resident, but at least I did it as a fellow during my training. But the difference between audit and clinical research, it's very thin line. People think that you are keeping cases just for research, but that's not. It's for self-improvement, because scientific research asks, are we doing the right operation? But audit research asks, are we doing the operation right? And again, as I said, it takes a little bit of humility and self-criticalness to identify what is going wrong with your patients. And many patients start auditing their practice, in the beginning find deficiencies, which kind of leads to a different way of doing things, which is called clinical research in the end. So there's one easy way of doing it. I'll give away my database to you for free. You can download it. You can take a picture of the QR code later, like Neeraj did. So just sit back. I'll show you how I do it on Notion. It's a free software. So it's like Excel on steroids. So this is like a spreadsheet, and you can store your data on it. But more importantly, every row can pop up like this drop-down menu. And if you populate them with your own like ICD-10 codes or diagnosis codes, you can quickly pick out the diagnosis or whatever you want to store and enter the data. You can, so this is like an example of this patient where I am storing the address of the patient, the phone number of and this I'm doing real time. This is not something I take out time extra for it, because I do tend to do this pre-op. As a part of pre-op planning, our fellows send these WhatsApp messages to us for pre-op assessment and all, and I just copy paste them here many times, and put your operative notes and all the different things that I want to track, and most importantly, I would track the outcomes of the patient. So because this app is also available on the phone and iPad, and also if the patient comes to me in the OPD, I pull out my iPhone, go to the patient's record, and put that patient's outcome there and there itself on my phone, and it lives on the cloud. It is, as long as you have internet, you are doing it. And this last couple of things I learned in my fellowship years, that every patient, they made us think about the difficulties you encountered in the case and the lessons you learned from every case. So I tend to write wherever possible about every case, what I learned from this case, or if any difficulties I encountered, because there is always a better way of doing things. But unless you analyze your own case, you will not think about it that way. Now there are multiple ways to sort out this database. I can look at my calendar of surgeries. I can look only the craniovertebral cases. I can put any search criteria, look only at TB patients, the cases that I did last year or the cases I did previous year. There's a very quick way of categorizing them and looking at them. And obviously you can record complications, and if you are unfortunate enough in this patient, if you have multiple complications, you can put multiple complications for a patient. But the important thing is I tend to use that end result classification by Codman, because it gives you kind of that way of thinking about what really went wrong with a particular patient. If you have a complication, you can search database very easily. Here I'm typing scoliosis and I'm getting all the records that have the word scoliosis in it. So it's like instant. I'm getting this Excel. I can export this Excel sheet, give it to my resident and tell him, look at all these patients. Or this is like dural injuries. I'm typing and I'm getting all the dural injuries that I have had. And you can give access to this database to your fellow. And the fellows at Hinduja do this for keeping database for patients, and they can access content. And obviously it's available for iPhone, iPad, Android, Windows, everything. So whichever device you have, you can flip out your phone and type immediately that data. You can scan this QR code, go home, click on it, see my database. You can duplicate it, put it in Notion, and then start using it. And if you find a better way of doing it, please do share, and I'll learn from it too. Thank you very much.